Hello and welcome to webinar Strength and Conditioning for Strength and Power Sports. So to all our participants, we will be running a live Q&A at the end of webinar. So we have enabled our chat feature. It's on bottom side of your screen. So if you have any questions, just pop them in there. And by chance, if you miss any part of the presentation, don't worry. On demand, we'll be giving you some highlights of the recording in YouTube. Okay. So yesterday we have already had an introduction of Professor Ken, and we heard him present on eccentric exercises, characteristics, and application. So without much delay, let us welcome Professor Ken Nosaka for his talk today entitled Eccentric Exercise Training for Health, Fitness, and Athletic Performance. Over to you, Professor Ken.
Yeah, thank you very much. Thank you, Dr. Saju Joseph, for the introduction. So my talk today is eccentric exercise training for health, fitness, and athletic performance. I know you are more interested in athletic performance, but I'm also covering health and fitness aspects. So what do you remember from yesterday's presentation? So what do you remember most? So I talked about these one yesterday. So eccentric exercise is not eccentric. Eccentric exercise is less metabolically demanding, but more cognitively demanding. Eccentric contraction can generate greater force than isometric or concentric contraction. So unaccustomed eccentric exercise induces muscle damage characterized by delayed onset muscle soreness and prolonged decrease in muscle function. And eccentric exercise intensity, velocity, muscle length, repetition number, age, conditions of individuals, and muscles and exercise and sports, different kinds of exercise and sports affect the magnitude of muscle damage. The magnitude of muscle damage is reduced when the same or similar eccentric exercise is repeated. This is called repeated body effect. By using preconditioning exercise, symptoms of muscle damage are attenuated. This is what I covered yesterday, very basic things. So it was not that interesting, I think, for most of the people. Today, I'm covering more about practical application for these basics. Okay. I hope you can enjoy this one more. So I start from physical activity, exercise, and sports. Are they same or different? So this is my understanding. Physical activity contains exercise and sports. Sports are part of, or maybe some kind of common for the exercise. For example, walking. So you can walk to work or walk to school. This is more physical activity. But when you're using a walk for the exercise to improve fitness, this is exercise. But we can do race walk, which is sports. So same exercise, like walking could be physical activity, exercise, or sports. However, all of them are movements. So movement was generated by skeletal muscle. So our body has like a 40 to 50% of body mass is skeletal muscle. Then skeletal muscle is an engine for movement. Then muscle contraction is a kind of responsible for the movement. But in order for the muscle contraction to occur, all our system, like cardiovascular system, nervous system, respiratory system, digestive system, and skeletal system work together to produce movement. Thus, whole body is affected by skeletal muscle or movements. So exercise and sports science is for both directions. For example, okay, so when we are dealing with like a patient, elderly, and children, adults, so we are dealing more family cards. But when we are dealing with athletes, we are dealing with F1 car. But we can apply same theory to both directions. So we have to know the basics. Then we have the application, also translational approach. Then we have to make the research to practice. This is the most important thing. But we need to cover both. That's why today's talk, I'm not only covering for athletes, but also talking about patients, elderly people, and also general population. So before starting my talk, I just want to just cover COVID-19. So this is India. I heard that the situation in India is not so good in terms of COVID-19 infection. So like most of the people just mild, but it becomes severe or critical. This can cause a lot of deaths. I hope the situation in India is getting better. So, but when COVID-19 is kind of pandemic, so we are asked to stay at home, the isolation, many people work from work, and then many kind of athletic gyms, exercise facilities closed. So definitely many people don't have any like a reduced physical activity, exercise and sports opportunities. So this could also occur to the athletes. So definitely COVID-19, coronavirus, affected many sports events, including Tokyo Olympic Games. So we are supposed to have all Tokyo Olympic Games in this month, but it was postponed to next year. I really hope we can have the Tokyo Olympic Games in next year, but we never know what will happen. Okay, so this is the kind of, I got this article from a German Journal of Sports Medicine, it's published just recently. Title of the paper is Sports, Exercise, and COVID-19, the disease caused by this virus. So I wanted to just focus on here. So for athletes, what problems are caused by COVID-19 lockdowns? So no competitions, no group training. In some countries, no outdoor training or no anti-doping tests. What exercise is recommended? Continue training, but avoid exhaustive training to avoid compromising immune function, according to this article. So anyway, so if we are coaches, so in this very difficult situation, how to maintain their fitness and performance is a key issue. But lives matter. So for many people, maybe health is more important than sports. So we cannot ignore maybe health issues or maybe importance of health above sports. Okay. Now I'm changing the topic to eccentric. So there are many professions. Then we are thinking about their performance. Okay. Their competency, fitness, fatigue reduction, recovery from fatigue or recovery from work, injury prevention, and health as well. So these professions include soldier, firefighter, nurse, actor, and athletes or other professions. So today's talk is more about how eccentric training can affect their performance, especially elite athletes. So I used to be a sprinter, I told you yesterday. So when I was a sprinter, my hero was Carl Lewis. So now I play tennis. My hero is Roger Federer. So why are they so good? So factors affecting athletic performance is many. For example, performance affected by genetical potential, and also dietary nutrition is very important, and sleep and quality of the duration is important, and also social life is also an important factor. Academics is also affecting performance too. But today, I'm focusing more for the training for fitness. The fitness training can definitely affect performance. When it comes to fitness, there are many different components. The endurance, stamina, strength, flexibility, power, speed, coordination, agility, balance, accuracy, and other things as well. So these are components of fitness. So as you have already known that, there are training principles: specificity, progressive overload, the recovery, reversibility, individual needs. And also talking about training, we have to know that the frequency, intensity, time, and type fits are important. I think you have already known these ones. So I'm just talking about overload recovery. So this is a typical figure to describe overload recovery. So this is a training overload. Then this is the baseline fitness level. In the recovery phase, we are expecting this some kind of overcompensation or super compensation to increase the kind of a baseline higher. So then training is going very well. We can gradually improve the, gradually improving the performance. So this is like this, load is increased, adaptation occur, then increase next level, adaptation, then next level. However, in relation to muscle damage or eccentric exercise, so I used to believe no pain, no gain. Is this correct? So for example, if we need damage to improve their performance or improve their adaptation more, if damage does not occur, no improvement. But if damage is very severe, could be not good, okay? But my question to you is pain required for gain? Or does muscle damage stimulate muscle hypertrophy? So is it necessary to damage muscles to maximize muscle adaptation? So if you want to make this kind of body, but you want to be like this, you need to do kind of painful training or eccentric training to damage your muscle? What do you think? So there are some articles kind of describing whether muscle damage is necessary for muscle hypertrophy or muscle strength gain. So this article published in 2012 in Journal of Strength Conditioning. So the title of this article is, Does Exercising Muscle Damage Play a Role in Skeletal Muscle Hypertrophy? So they say, this kind of he says, okay? So signaling via inflammatory cells, like neutrophils or macrophages or other kind of myokines, these are important factors for hypertrophy. Or the satellite cell activation is very important hypertrophy. IGF-1 signaling is important, and cell swelling is important. They could be induced by muscle damage. Then they can lead to hypertrophy. However, actual direct cause-effect relationship is yet to be established between exercising muscle damage and muscle growth, which is hypertrophy. So basically, we don't need to, we cannot say muscle damage can cause hypertrophy more. Okay. So this is other study. Is muscle damage necessary? So this study published in European Journal of Periphysiology in 2018 by Damas et al. So this is a damage response. Damage response is getting smaller over training. Okay. However, muscle hypertrophy is getting bigger and bigger over the training. So their conclusion was that we conclude that muscle damage is not the process that mediate or potentiate resistance training induced muscle hypertrophy. So muscle damage is not necessary, or at least muscle trophy is not the process that mediate or potentiate hypertrophy. So this is my figure. So even concentric contraction can induce hypertrophy, but eccentric contraction is better stimulus for the hypertrophy, such as signaling pathway to increase protein synthesis is increased by eccentric contractions. However, if muscle damage occurs, muscle protein degradation occurs more, which is a kind of negative aspect. So we don't need muscle damage, but we have to maximize the use of eccentric training. So my kind of conclusion at this moment, based on reading our research, we need eccentric exercise, but we don't need muscle damage. That's why we need to minimize muscle damage, but maximize the use of eccentric exercise training to maximize hypertrophy or even strength gain. So this article, this is a very nice article. I think you can have access to this one. So Functional Morphological Kinesiology, published 1929 last year. So they summarize underlying eccentric exercise training effect on hypertrophy and strength and power output. So everything is good. So eccentric training can increase anaerobic signaling, satellite cell activation, motor unit recruitment, activate the motor cortex, and force production capacity, possibly increasing fast twitch motor unit preferential recruitment. Then they can contribute to hypertrophy. Eccentric training can increase motor unit recruitment, activation of motor cortex, force production, motor unit discharge rate, and increase motor unit stiffness, and decrease regulation of the inhibitory reflex. Then possibly also fast twitch fibers, other things, and they increase strength. For power, very similar to strength, eccentric training can improve power. So they conclude that eccentric training could be a very good training to improve hypertrophy, strength, and power output. So this is from other article published in 2016, Sports Medicine. They concluded that eccentric training can improve muscle mechanical function to a greater extent than other modalities. Also, they say eccentric training may be especially beneficial in enhancing strength, power, and speed performance. I agree with this one. So there are a variety of eccentric exercise training. For example, normally concentric strength is lower than maximal eccentric strength. So we can use very low intensity exercise, which can be easily handled by concentric, such as using a 2 kilogram dumbbell, lowering slowly, which is low intensity eccentric exercise, or eccentric biased exercise, such as downhill running or eccentric cycling. And also prolonged eccentric contraction means you can just lift weight, lower slowly. Okay, so same weight is used as concentric, but you can prolong the duration for the eccentric phase. Or we can have accentuate the eccentric training. So in this case, we can have a little bit greater load than maximal concentric to do the accentuate eccentric training. Or we can do maximal eccentric exercise. This is more close to the maximal eccentric capacity, much, much greater than concentric load. But it seems to me that all of these can contribute to increasing eccentric, concentric, and isometric strength. Also physical function, athletic performance is improved. And then also it is contribute to injury prevention. So not necessarily very high intensity eccentric training, but also lower one is effective. So this is a very classic study, compare between eccentric, concentric, eccentric training. So they assessed concentric torque, eccentric torque, also cross-sectional area of the muscle. As you can see here, when you are doing concentric training, concentric torque increased more than eccentric training. However, you are doing eccentric training, you can improve much more eccentric torque than concentric training. And then cross-section area is increased a little bit more after eccentric training than concentric training. But overall, eccentric training can improve concentric eccentric torque more than concentric training. But if you just need a concentric strength, concentric training would be good. But in normal, most of the sports, you need both eccentric and concentric strength. So it may be better to do eccentric training more than concentric. This is another study from Journal of Physiology 2000 by Hortobagi et al. So they compared the eccentric training, concentric training, and eccentric and concentric mixed training. Interestingly, they found that eccentric-only training can increase eccentric strength more than the mixed training. And also eccentric-only training can improve isometric strength better than concentric or mixed training. But concentric strength is increased more for the concentric training or mixed training. Of course, they are doing a concentric training more, but even eccentric-only training can increase concentric strength. So overall, eccentric-only training is better than concentric or mixed training. So this is our study, which will be presented at a conference in a virtual conference in Japan, maybe middle of July. So we did eccentric heel kind of training. So we used, randomly allocated one leg to heel raise only, just raising heel 1 second, and other leg, other leg to heel raise. So we can do the both legs together for the heel raise, but one leg is going down, like a heel drop in 3 seconds, slow eccentric contraction. So this was done 2 sessions per 8 weeks. Then we are progressively increased the number of the repetitions. So concentric only leg did not show any change in the strength and muscle thickness or other parameters. But eccentric and concentric leg showed significantly increase in maximal voluntary isometric contraction of the plantar flexors, 26% increase. And also range of motion of the ankle joint improved 20%. And then muscle thickness of the gastrocnemial muscle increased about 8%. But this did not occur for the concentric only leg. But penetration angle, fascial length, and tendon stiffness did not change for both training. So it means that just adding eccentric training can increase strength and flexibility and muscle hypertrophy more than concentric only. In this particular study, so we used back squat, Then we asked them to do 2 types of training using university soccer players. So one group used concentric, eccentric, but in this case, eccentric phase is 4 seconds. So 2 seconds of back squat concentric, then rowing in 4 seconds. We prolonged the duration of the eccentric. But other group did concentric and eccentric, both 2 seconds, 2 seconds up, 2 seconds up. So this group is definitely longer eccentric duration. However, we did not find this is more beneficial than this training. Both groups showed significant improvement of the 1RM back squat, but much greater improvement of the 2 second and 2 second one. Just prolonging the eccentric phase does not necessarily improve the strength more, And also jump height, counter movement jump, squat jump height was improved more for the 2 second one than 2 second and 4 second one. So in this particular study, we did not find any beneficial effect, but just prolonging the eccentric contraction time. So in this particular study, Walker et al., it was done at ECU, our university. They compared between the same load for both concentric and eccentric phase, and other one is accentuates eccentric loading. So 4% greater load during the eccentric phase was added, like this one. When you are doing concentric, then this group is same weight as lower, but other group is we put extra weight for the eccentric phase. This is also the case for knee extension exercise. So in comparison to traditional training, accentuated eccentric training showed greater improvement of concentric torque and also eccentric torque and also isometric torque. So everything improved better by accentuated eccentric loading. So of course, so we are doing more loading for the eccentric phase, eccentric torque improved more, but also concentric torque and isometric torque also improved more. So accentuated eccentric training is very good to improve all kinds of strengths. So this is a review article published in 2019 that is kind of same as that I introduced earlier. So they suggested eccentric training method for beginner, intermediate, advanced athletes. So for beginner, they can do less than kind of one same as body mass squat. So if your body weight is like 70 kilo, so they cannot do more than 70 kilo with squat. In this case, they are suggested the tempo eccentric training. Tempo means that you just need to prolong the eccentric phase for the time. Or flywheel in inertial training. So this is, I'm going to show you the kind of picture later, but this is the flywheel training or plyometric training at very low intensity. Okay, so low, moderate intensity plyometric exercise. But when their kind of strength is higher, they can do the 1.5 times body mass squat. Then they suggested that maybe flywheel inertial training and submaximal accentuated eccentric loading and higher intensity plyometric training. More advanced level, they can lift more than 2 times body weight, body mass squat. Then they recommend the maximal to maximal accentuated eccentric loading and also plyometric training. But please note that accentuated eccentric training, not only eccentric contraction, also they have to do concentric before eccentric. So we are more interested in what happened for the eccentric only training. So this has not been done so much. So we are interested to say when we can introduce eccentric only training and whether eccentric only training can improve strength, power, agility, other sports performance better than mixing eccentric and concentric training. So I'm going to show you some of the results, okay? But before that, so how important eccentric training in athletes? So during athletic kind of matches, like rugby or soccer or any team sports, athletes are performing a lot of eccentric contractions. For example, try to change the direction or try to stop or try to avoid falling down. They do a lot of eccentric contraction. So the more they do eccentric contraction, during the match, strength, power decreases. And also toward the end of the match, endurance also decreases. So we actually counted the number of eccentric contraction in a match, that is a soccer match. If they do more eccentric contraction in a match, toward the end of the match, their endurance also affected. So that is not good. So maybe number of eccentric contraction for the first or majority of the match could affect the last part of the match a lot. Then that can decrease endurance. Then eventually performance decrease toward the end, then they cannot win. Also, they could suffer from muscle damage in next day. They may get sore or they have strength loss. If that can sustain, if they have a match next day, they cannot win. So we need to train them eccentric training. They need to do eccentric training to improve muscle strength and power, and also endurance can be improved by muscle and eccentric training. Then muscle adaptation can minimize muscle damage as well. Then performance eventually increased. This is what we think. So we did, in collaboration with the Institute of Malaysia, Sports Institute of Malaysia, this is Rugby Sevens Malaysian team. So they did leg press eccentric training for 6 weeks. Then they have 6 weeks off, then 3 weeks before the East Asian Games, SEA Games. So this is first week, they did 75% RM concentric max, 8 reps, 3 sets. And then second week, this intensity increased to 80%. Third week increased 85%. Fourth week increased 90%. Then 95%. Week 6, 100%, but 100% of concentric maximum. So yesterday I showed you concentric maximum is like 30 to 40% lower than eccentric maximum. So this is still submaximal eccentric training. And then they had a Ramadan break for 6 weeks. They didn't do any eccentric training for these 6 weeks. They did a kind of rugby training, but not eccentric training at all. So then, after this Ramadan kind of break, they started 3 weeks for a maximal eccentric training. In this case, 100% 10% of concentric max. And then last week, 130. This is close to the eccentric max. Okay, so this is the results. So before the training, eccentric strength is 680 kilograms, which is still very high, but 680 kilograms. Then concentric max was 499 over 500 kilograms. Okay, so then here, so T2, after the 6 weeks of submaximal training, it improved 26.7% for the eccentric strength, 14.6% for the concentric strength. Then they had a break, 6 weeks of off training, eccentric training. So then their strength decreased, but only 6% decrease over 6 weeks, not so much. And concentric strength decreased a little more, but only 10% compared to the improvement of the 15%. Then they started 3 weeks of supramaximal eccentric training. This improved 21.8% strength in 3 weeks. Also, concentric strength improved 16%. So overall, in this period, this is kind of high trained athletes, but still we could improve their strength, eccentric strength 45%, and concentric strength by 20%, which is huge improvement. So according to their coaches, so the athlete became faster, also agility was improved, and then change of direction ability is also good, and then not so much damage or maybe an injury occurred. So because of that, they won the 2017 SEA Games. I don't know how much this eccentric training contributed to this one, but I assume quite a lot. Okay, so this is just previous kind of data. So I don't know whether they are still continuing eccentric training, but because 2019, last year, they didn't win the SEA Games. So maybe they are a little bit lazy for eccentric training. So is eccentric training effective for improving road cycling performance? So as you know, cycling is more concentric type of sports. So cycling is more pure concentric exercise. However, if they are doing eccentric cycling, so this is the kind of backward cycling, you can do 350 to 500 watts easily for the eccentric cycling. So we are interested in whether this kind of eccentric cycling training can improve their road cycling performance. Unfortunately, we don't have a kind of confirmed data yet. We are doing some participants, but not enough yet. But eccentric cycling training appears to be very effective for improving cycling performance for the road cyclist. Definitely, eccentric cycling training improved sprint cyclist performance a lot. So this is the study we did. This is eccentric versus concentric cycling training. So this is a machine called Glucox. And then this is from South Africa. This cycling machine can do both concentric cycling and eccentric cycling. So we divided the kind of participant in 2 groups. One group did concentric cycling, other group did eccentric cycling. So they did training twice a week for 8 weeks. Then we periodized the training. So some weeks they have 2 minutes on, 2 minutes of kind of cycling, kind of high intensity, 1 minute off. Or some weeks they did 2 minutes on, 30 seconds off. So a little bit shorter interval. So eventually, we measured their performance before and after 8 weeks of training. So VO2 max improved more for the concentric training because intensity was, stimulus to the heart and pulmonary system was greater for the concentric training. So larger increase. But other parameters showed greater increase for eccentric, especially the knee extensor strength increased more for the eccentric cycling training. Jump performance improved much, much more for the eccentric, not much at all for the concentric cycling training. And then this is concentric peak power max improved more for the eccentric training. So like a cyclist, even like a road cyclist, last like a 200 meter or maybe short kind of distances are key. So if they can have more power, then they can win the race. So this is very encouraging. So this may be showing that eccentric cycling training could be also good for the endurance cyclists. So this is our study, and one of my PhD students' study. So he's a kayak coach. This is a sprint kayak, 200-meter kayak. So in this study, one group did bench press, bench row, chin up, both concentric and eccentric. This is more traditional training. So concentric followed by eccentric contraction. Okay. Other group did only eccentric training. So bench press only eccentric phase, bench row only eccentric phase, chin up is also only eccentric phase. So training was done 3 sessions per week for 8 weeks. Okay. As you can see here, eccentric only training group showed improvement of the race time, but concentric eccentric group did not show any improvement. And bench row, bench press, chin up, deadlift, and strength total improved more for the eccentric training group. Okay, and also isometric bench press also improved better for the eccentric training group. Mid-thigh pull is also improved better for the eccentric training group. So everything was better. So eccentric only training was better, even for the kayak athletes who are doing concentric contractions more. Okay. So this is kind of interesting. So I say that this is flywheel training machine. So you just do the concentric, then this is pull back. Concentric, bring back. This is flywheel eccentric. This is more kind of motor-driven eccentric. So you don't need, you just need to stand up with your only body weight. Then this is pull. Okay. So in this particular study, we trained only one leg. So in this case, only right leg. Okay. So then when we trained one leg, so, but actually we did this modality and this modality, but actually they are very similar. So we combine them. So when compared to pre and post, thigh muscle mass measured by DEXA increased. Okay, so one arm strength also increased a lot. Okay, one arm strength increased a lot, and also power improved a lot, and also the counter movement jump also improved. Okay, interestingly, so this leg was not trained at all, but this untrained leg, non-trained leg also showed improvement of the strength and improvement of one limb. Okay, this is thigh lean mass, muscle mass increased. So strength increased and power increased and camera jump of the one leg increased. So somehow this leg training transferred to the other leg. Okay, so we saw like a similar improvement of one leg for the trained leg and also non-trained leg. So this is very interesting because when doing eccentric training, we can see greater transfer effect of one leg to the other. So it may be better to train legs separately than doing a squat, doing the kind of squat exercise using both legs together. Okay, sorry. Next one. So this is a loaded plyometric exercise on post-activation jump performance enhancement. So after doing some, this is a 5 back squat, we can see improvement of the counter movement jump. So we chose participants who showed more than 1 centimeter increase in counter movement jump after this 5 RM back squats. Okay, so then they did 5 times 6 drop jumps with 20% of body weight. This is a drop jump exercise to damage the muscle. Okay, and then next day, 2 days, so 50 minutes later, next day, and 40 hours later, they did the same thing to see this counter movement jump improve from pre to post 5 RMs back squat. Okay, so this is the effective drop jump exercise. After drop jump exercise, 5 RM back, the drop jump is 5 5 times 6 drop jumps, okay, 30 drop jumps with 20% of body mass, body weight. So we can see decrease in maximal voluntary contraction torque of the knee extensors immediately post-exercise, but back to normal by 24 hours. So not so much damage occurs. Muscle soreness increase, but not very massive soreness. Okay, very mild soreness occurs 24 and 48 hours. So this is before the drop jump exercise. Everybody's showing some improvement of the drop counter movement jump height. So back squat exercise can increase counter movement jump height, maybe up to 1 to like close to 5 centimeter improvement. Okay. So before the exercise, before the drop jump exercise, 14 out of 14 people showed improvement of counter movement jump height. But when after drop jump exercise, only 3 people showed improvement of the height. 24 hours later, no one showed improvement of the height. Some showed decrease. And 48 hours later, only 1 person showed improvement after back squat exercise. So this showed that like a post-activating potentiation is gone when you have you performed drop jump exercise. Okay. However, interestingly, counter movement jump height increased 24 and 48 hours after exercise. So 10 out of 14 people showed increase. So this could be a priming effect. So once you did drop jump exercise, which did not show so much damage, but after that kind of exercise, you may be able to improve your performance. So just 1 to 2 centimeter increase the jump height could be very beneficial for some sports. So this may be very interesting. So if you are doing mild eccentric exercise to induce some little bit soreness, but not so much, could improve your performance in the next days, at least like 24 to 48 hours. This could be explored more in the future studies. Also, eccentric training is very beneficial for injury prevention. So many people do Nordic hamstring exercise to prevent injury of the hamstrings. So in this case, maybe hamstring stretch a lot. So this kind of exercise is very beneficial. So this study, published just recently, they assessed, okay, this hamstring strengths at the kind of this part, and also isokinetic torque. Okay, there's no good correlation. So this study showed that, okay, Nordic hamstring exercise is not necessarily related to strength of the knee flexors. So we also did a study, but we didn't find any good association between Nordic hamstring force and eccentric strength of the knee flexors. So we don't know what this Nordic hamstrings is actually doing, whether that can increase eccentric strength of knee flexors. We don't know that. However, Nordic hamstring exercise can work. I mean, this is a study from hamstring injury in amateur soccer players. Definitely, if you do the Nordic hamstring training, it can reduce injury of the hamstrings a lot. So still very effective for prevention of hamstring injury. But that may not be necessary due to the increase in eccentric strength of the knee flexors. So we need more studies to find a mechanism how Nordic hamstring exercise can work to reduce injury of the hamstrings. I'm just switching to the health aspect. So we know exercise is medicine. So exercise is effective for 26 different chronic diseases, such as psychiatric disease, neurological disease, metabolic disease, cardiovascular disease, pulmonary disease, musculoskeletal disorders, and cancer. So exercise is very effective for prevention or treating many diseases. So with aging, we have decrease in muscle mass, which is called sarcopenia. So decrease in muscle mass can lead to decrease in muscle function. This is 20-year-old man. This is 65 years old man. Massive decrease in muscle mass. Then decrease in muscle strength. Then when we have a decrease in muscle function, then people have more fatigue, then increase in falling risk, then people avoid physical activity. Then this is a vicious cycle. More decrease in muscle mass occur. But that can lead to many diseases. So energy consumption decrease, then that can induce metabolic syndrome, bone mineral density decrease, bone is getting weaker, smooth brain decreases, that can maybe induce some like a dementia. And the insulin resistance increase, then you have more risk for the diabetes. Also, risk of the coronary heart disease increases. So everything is starting from muscle, okay? So we all age, and then when with aging, disability increase, especially after 80 years of age, about 60% population have some kind of disability. Then 30% of people have very severe disability due to stroke, musculoskeletal disorder, and other things. So we need to avoid that. So as you can see from this graph, with aging, definitely fitness decreases. This is muscular functional capacity decreases. But this decrease cannot be stopped. Everyone has maybe 1 to 2% decrease in strength and muscle function over a year. However, you have an injury or you are hospitalized for a week. This decrease 1 to 2% per week. So this decline is much rapid. So injury and disease can make this decrease in muscle function and other kind of functionality much rapid. Then leads to the disability threshold earlier. Okay. So in this case, these people cannot enjoy their life. Maybe a quality of life is decreased, which is not so good. And also it costs a lot to the society. So we need to kind of change this one. Even coming back here, like getting close to disability threshold, if they do resistance training, then it is possible to increase this strength higher. And then muscle strength can be improved 30% in 8 weeks of strength training easily. Then they cannot get to this disability threshold. Not now, much later. Okay, so we need to increase that like health span. And then in order to do that, regular exercise is a key. Okay, so especially resistance exercise is very important. Muscle strength will be decreased 2% per year without any training. But you are doing a resistance training for the elderly people or even younger people. 2 to 2 months of that resistance training can increase muscle strength by 30%, which is account for 50% of the strength loss, 50 years of strength loss. So we can recover 50 years of strength loss in 2 to 6 months, which is very encouraging. So it is very important to maintain and improve muscular muscle. Okay, resistance training is necessary, but in order to do that, we need to consider muscle contraction type. So in this particular study, we immobilize the muscle experimentally. So this is immobilized muscle, the 4 weeks. So they are not immobilized all the time, only 8 hours a day. Okay. Then this arm, not immobilized arm, is a training 3 times a week, is a concentric, eccentric, okay, or eccentric only. So this is just lowering the dumbbell. Then investigator helped for the concentric phase, just lowering the dumbbell. But as you can see, this is much heavier than concentric one. Okay, but we match the total work. So for trained arm, when you do eccentric and concentric training, so muscle arm circumference increase a little bit, but if you do eccentric only, much greater increase in arm circumference. And strength also increase more using heavier weight for the eccentric only, 21%, but concentric eccentric 13% improvement only. But this is very interesting because for this immobilized arm showed 28% decrease in arm circumference, also 22% decrease in strength. However, if we are doing concentric eccentric contraction for this non-immobilized arm, this arm circumference decreases only 2%, and then strength for this arm did not occur. However, if we are doing eccentric exercise only, we can see increase in strength for non-exercised arm, immobilized arm. So this shows that a very strong cross-transfer effect by eccentric training. Okay, so maybe that can be kind of applied for other situations. For example, your athlete has an injury, then one of the legs is immobilized, then after 3 to 4 weeks, massive decline in the muscle mass and strength loss, also range of motion could be decreased. Then it takes a long time to recover. However, they can do training for this healthy leg, especially they are doing training for healthy leg eccentric training, then we can minimize atrophy and strength loss. So we can maybe enhance the recovery, or we can minimize the kind of effect of this kind of immobilization. This could be used for your athletes. So we don't know the exact mechanism yet, but definitely eccentric exercise training can have a greater cross-transfer effect to the non-exercise leg or the exercise arm. So eccentric exercise contractions provide a greater stimulus for the cross-transfer of the motor of motor performance than concentric contraction. So then this can be applied for stroke patient. Normally stroke patient asked to use their impaired arm, but we are trying to approach this impaired arm from a healthier using eccentric training. So in this particular study, we did eccentric training using body weight or concentric training using body weight. So we found that just using body weight, eccentric training can increase muscle thickness of the thigh, knee extensor strength, chair stand ability, time up and go, this is like an agility test, 2-minute step test, and also balance test. So many things improve better for the eccentric training than concentric. So maybe we can ask elderly people to just sitting to chair slowly, then they can benefit from that. So in this particular study, 26 healthy elderly men were placed to eccentric training group or concentric training group. So they did only once a week training for 12 weeks. Then we gradually increase the intensity for eccentric and also concentric one. But concentric one, we don't need to worry about muscle damage. So they started from higher intensity, Okay, so no indication of muscle damage we found. Interestingly, eccentric-only training group showed greater increase in strength, isometric strength, chair stand ability, and also the one-leg stance balance test, and also agility. And interestingly, we saw greater improvement of the insulin sensitivity, such as resting glucose, resting insulin, it decreased more for the eccentric training group, and the oral glucose tolerance test improved better for the eccentric training group. And also triglycerides, total cholesterol, LDL cholesterol decreased more for the eccentric training group. And HDL cholesterol improved better for the eccentric training group. This was also the case for stair walking. So in this particular study, people went up the stairs, first to the 6th floor, then came back by elevator, which is ascending stair walking group, came back by stairs, and then using a lift to go back to the 6th floor, which is the eccentric training group. So they did 12 weeks of training, gradually increase the repetitions. So eccentric training is much easier. So descending stair walking showed much lower heart rate, lower blood pressure, okay? Much easier to perform going down. However, going down training, stair walking, descending stair walking training showed much decrease in heart rate and blood pressure for the resting, and also bone mineral density increase only for the descending stair walking group. muscle strength, chair stand ability, 6 minutes walking, balance, improve better for the descending stair walking group. And insulin sensitivity, blood lipid profile, improve better for the descending and ascending training group. So this is a COPD patient. This is a kind of pulmonary disease patient. They have very low oxygen aerobic capacity, but using eccentric cycling machine, they can perform much more work by eccentric for that lower heart rate. But by eccentric training, we can see greater improved walking ability, agility, stair walking ability, muscle strength, and also muscle mass. So much easier training is better for COPD patients. This is also good for the chronic heart failure patients. So their heart is a problem, but maybe more problem is skeletal muscle. So we need to strengthen skeletal muscle without burdening the heart. Then eccentric exercises may be good. Okay. It is also good for the brain. So maybe dementia, Alzheimer's disease, maybe exercise is very important, but maybe eccentric is good because eccentric exercise can stimulate brain better. So, nutshell, eccentric training, negative aspects, as showed you yesterday, DOMS, prolonged loss of muscle function occurs, but important thing is muscle damage is not necessary, not no pain, no gain. But we have a lot of positive aspects. So less metabolic demand, but muscle function, muscle mass, muscle coordination, flexibility improve, and also it is good for their health. Okay. So why eccentric exercise is more effective? We don't know, but probably some kind of effect on the brain system or central nervous system, or maybe to the nervous system, also muscle tendon behavior, or fascia movement, or maybe more myokines produced by eccentric, or more signaling pathways induced by eccentric contraction. So muscle contraction matter. So I think eccentric is very good. So I like this quote. So this quote is a 1950 Nobel Prize in Literature winner, Bertrand Russell. He said, "Do not fear to be eccentric in your opinion. For every opinion now, accepted once eccentric." So I would like to say I became eccentric person. I would like to say, do not fear to perform eccentric exercises, which are the best exercise medicine and training intervention for all. So we are developing eccentric-only gym. So when people coming to our lab, everything is eccentric. So warm-up is downhill walking, exercise eccentric cycling. We are doing a lot of resistance training eccentrically only. So we are trying to investigate whether this kind of gym is effective for patients, children, to top athletes. So couple last slides. So you are coaches, so you are coaching and mentoring your athletes, so which is very important job. So this is what I want to say. Probably there is no training that improves performance for all athletes. And there is no training that is bad for all athletes either. So it depends how to use it, okay? So I found this quote. This is a kind of a, not necessarily for the coaches, for the athletes, the business coaching quote. But this is very interesting. Probably my best quality as coach is that I ask a lot of challenging questions and let the person come up with the answer, okay? So based on that, this is my question to you. So I know, or maybe I have shown you, eccentric exercise has a lot of potentials, okay? Probably very good for your athletes as well. But I want to ask you, how can you use eccentric exercise to improve performance of your athletes? How can you try to find out whether it works? So this is homework for you, okay? I cannot give you any answer, but I want you to try to athletes whether eccentric is good, or how you can make eccentric training beneficial for your athletes. I like this song. So maybe if you can, maybe you can just go to this YouTube. This is a song used to be sung by Whitney Houston, but now Donna Winner sang that. One of the phrases, when I'm more than I thought I could be. This is what you need to do your athletes, okay? Their capacity, maybe sometimes they can do, that's more than they thought they could be. Sorry, the last thing is like I just rushed a little bit because of the time, but thank you very much for your attention. And I welcome questions and comments. And also I welcome collaborations. And also if you are interested in doing PhD or master's degree, I'm happy to be a supervisor for you, okay? So this is my email address. And I don't know whether this is correct, but see you again. Thank you very much.
Right. Thank you very much, Professor Ken Osaka. It was really an interesting presentation, very much practical oriented. Most of the research which you have put up has given a very positive note on how eccentric exercise works in certain moments, and also for general health and you know, for people with various issues, medical issues. Now I invite the floor to ask, I open the floor to ask questions to Professor Ken. So if you have any questions, you just drop down in the chat box. We will convey it to Professor and he will answer.
Yeah. So, okay, so there are some comments and answers, good, but I cannot read some of that. Maybe question is in Hindi. So, Saju, could you maybe pick up some questions and ask me, please? Or yeah.
As of now, there is no question, but one was in Hindi. That was he was actually thanking you. Dhanyawad.
Oh, thank you very much. Yeah, thank you. I wish I could read Hindi. Yeah. Yeah.
Okay. Okay, somebody asked, okay, Ajay Singh, wrestling coach, he was asking, can you elaborate priming effect?
Oh, okay. That's good. So priming effect is a little bit different from warm-up effect. For example, you can do some kind of exercise in the morning, so you can perform better for the training in the afternoon, or next day, for example. Okay. So in our study, we did an eccentric drop jump exercise. Then that exercise, in the recovery process, they can perform better for the counter movement jump in next day and also 24 hours later. So we have been investigating this kind of effect. For example, maybe if you can do some kind of exercise to stimulate your muscle or brain or even like a tendon, we don't know the exact mechanism yet, but that kind of exercise can improve their performance. So if we can maybe find out very good way to enhance the performance by doing some kind of exercise. But in that exercise, it may be that eccentric exercise is very beneficial, not damaging one, but maybe mild eccentric exercise can improve their priming effect, I think. Okay. And also, I forgot to tell you, also we are doing a lot of study about warm-up. But for warm-up, it is better not to use a lot of energy, but we need to stimulate the brain and the muscle. In that case, eccentric exercise is very good. For example, we are doing eccentric cycling before a competition. That can save energy, but still stimulating the muscle and the brain very well, so they can ready for the match better.
Okay.
Yes.
Another question from Mr. Kalyan Chaudhary. Can we have eccentric exercise without concentric exercise?
So eccentric exercise
without doing, he means that without doing concentric movements.
Ah, okay, right, okay. So yeah, so you mean that maybe eccentric, concentric alternatively?
Yeah. No, just eccentric alone.
Eccentric alone, okay, right. I think, okay, so this is my opinion, okay? But I think eccentric alone is better. Why? Eccentric alone save your energy, okay? So this is my kind of idea, okay? Not proven yet, but we can ignore specificity in resistance training. If we want to improve muscle function, okay, we can just do eccentric only. Then in the actual practice, they are doing a lot of concentric training, concentric exercise already. So in order to improve muscle function, or sometimes maybe you want to improve your muscle mass, or maybe power, we can do eccentric only. That is why I'm developing eccentric only gym. We don't do any concentric exercise, just eccentric only.
Okay.
Yeah.
And another question from Damanpreet Singh: can stretch shortening cycle be a limiting factor for eccentric training in training like plyometric exercise?
Right. So like a drop jump exercise, typical stretch shortening type of exercise. So you can drop jump, then jump. Okay. However, interestingly, like a drop jump, we don't see so much eccentric contraction. Or some kind of plyometric exercise, like a jumping, then the concentric. We often see muscle is just doing isometric contraction, not eccentric. So plyometric exercise is kind of eccentric exercise, but not that much. So I'm just considering whether the plyometric exercise is actual eccentric. Maybe if you overload your body by like a 20% of your body weight, that is more eccentric. But just using your only body weight, that may not be so much eccentric. So plyometric exercise is a very good exercise, but not necessarily eccentric training.
Okay. This question is from Mr. Nishad Kumar, athletic coach. Okay. What can be an universal time ratio accepted on prolongation of concentric and eccentric activity of an exercise during resistance training? Time ratio?
So I didn't understand the question very well. Sorry. Yeah.
Yeah, he's asking the time ratio accepted on prolongation of concentric and eccentric activity of an exercise during resistance training.
So if I understand correctly, so it means that maybe doing both eccentric and concentric, but maybe how we can make the kind of contraction time.
Yeah, that's not actually, it's like, you know, isocentric, you have, when you're doing eccentric exercise, you may have 30 degrees per second. And when you're doing the concentric movement, it may be a little higher velocity. So
okay, that's okay.
What should be the time ratio between eccentric activity and concentric activity?
Okay. So I assume in that case, you are using same weight for eccentric and concentric, right? So if you are using the same weight for eccentric and concentric, okay, I think it is better to have a very quick concentric contraction. The eccentric contraction is slower. Let's say maybe concentric contraction only 1 second, or maybe less than 1 second. The eccentric is maybe 3 seconds. If you're using the same weight, okay? But as I showed you, we just did a kind of squat exercise, 2 seconds, 2 seconds versus 2 seconds, and eccentric 4. In that case, 2 seconds, 2 seconds was better, okay? But I think maybe in that case, maybe already 2 second eccentric is kind of slow. So in order to improve performance better, I think it is better to do quicker concentric phase. Maybe less than 1 second concentric, very fast velocity concentric. The eccentric is a little bit slower, like a 2 seconds or 3 seconds. So using the same weight for both phases, I think, yeah, prolonging the eccentric is a good way to start with. And also, eventually, it is better to do fast velocity eccentric training. So initially, we can start from slow, but very heavy weight, very fast eccentric. It's very strong mechanical stress. So yesterday, I showed you the kind of how to introduce eccentric training. So we start from slow velocity, then gradually increase the velocity of the eccentric contraction. The very fast eccentric one is very dangerous as well, but which is very effective too. I hope I answered the question.
Yeah, fine. That's
Yeah.
a good answer.
Yeah.
There's another question from Padmakar Rao. Which one will be best among two eccentric exercise, open chain eccentric exercise or closed chain eccentric exercise?
Yeah.
Based on muscle origin and insertion.
That's a great question. Depending on the situation, for example, open chain is better, I think, because let's say, but I mean, if you are recovering from injury, I think it is better to start with closed chain, but gradually doing an open chain. So depending on the purpose of the training, and also that depending on the athletes. So if you just try to isolate a muscle, maybe closed chain would be better. But if you are more maybe trying to use the eccentric training for more super performance improvement, open chain would be better. So depending on the situation, I think.
Okay, Professor, time is running out and we have the last question.
Yep.
This is from Subhash Sarkar, athletic coach. Eccentric training may facilitate the agonist muscles only, but antagonist muscles of a movement will not be neglected for proper growth of muscle in training.
Okay, so I don't know whether I understand the question correctly, but actually, very good point, I think. Okay, so when we are doing eccentric contraction, okay, for the biceps, for example, okay, so doing this one, so normally elbow extensors is silent, okay, but let's say, so, but we need to think about as a kind of movement, okay? Maybe we need to think about how we can maximize the stimulus to this muscle. Then if this muscle is still working, that may not be the best. In order to maybe, again, say, stabilize the joint, maybe this is also necessary. But interestingly, okay, this is very interesting kind of things. So when we are doing eccentric contraction, like a core muscle should be involved more. So if your joint is very like not kind of fixed, you cannot do eccentric contraction. You have to fix the joint to the eccentric. Also, any type of eccentric, you have to fix your body. Your body is not fixed, you cannot do eccentric. So eventually when you are doing eccentric contraction, you are using more muscles, especially the deep muscles. So that may not be necessary for the antagonist muscle, but we are controlling auto muscle in the same time for the eccentric contraction. That is why that is more difficult, I think. Yeah.
Okay. And Professor, last question. Okay.
Yeah, sure.
You have spoken about the cross training effect. Okay.
Yep.
So now let's say we are doing eccentric training for the agonist. Whether the strength in the antagonist will also improve if in such cases.
That is $1 million question, but actually we didn't find that, okay? So when we are doing elbow flexor eccentric training, we didn't find any strength for the other arm knee elbow extensors, only 1-to-1. Okay. And also we are doing like a knee extensor exercise. We didn't find any increase in knee flexor of the other leg. So only homologous muscle, same muscle. Okay. So contralateral effect can occur to the elbow flexors to elbow flexors, elbow extensors to elbow extensors, not flexors to the extensors.
All right.
Yeah.
Okay, with this, I think we'll end the session. Thank you very much, Professor Ken. You have taken lots of pain to be with us for 2 sessions on on consecutive days. It was really interesting. Yeah, it was really interesting that you had given a lot of information on eccentric training, and actually our coaches and strength and conditioning specialists are actually benefited from your session. we hope that we could have more sessions from you, and probably one day we would like to invite you to India and then have theoretical sessions in various parts of the country where our sports institutes are there, and that would be a better exchange of ideas, and even the people can have one-to-one discussions with you also. Thank you very much, Professor.
Yeah, and also please don't forget. Okay, so can you see the screen or not? Maybe not.
Yeah.
Actually, I want to learn from your coaches, like from you. Okay, how can we use eccentric exercise to improve performance athletes? Because we cannot do any studies for the top athletes. Okay, so that's why we are just using university students and as a subject. So their data may not be same as top athlete data. So if you have any interesting kind of findings from your coaching experience to use eccentric exercise, please let me know. I want to know more about actual fact, how it can work. Yeah.
Sure, Professor. Yep. Thank you very much. Yeah, we'll get back to you on this question, what you have asked, and coaches would like to know also more about it. Probably they would have had a lot of experience while training the athletes. And if I get some questions, I'll post it to you for your info. And once again, thank you very much.
Thank you very much.
Thanks a lot.
Have a good afternoon. Bye.
Bye.
See you again.
See you.